Lower limb, surface anatomy, compartments of the leg, and dorsum of the foot. Posterior compartment of the leg, superficial muscles. Gastrocnemius and Soleus. The bulk of the calf is formed by the gastrocnemius and soleus muscles. They both unite to form the Achilles tendon that is attached to the middle of the posterior surface of the calcaneus. Stand on your toes as shown. The two heads of gastrocnemius and soleus muscles are both prominent and palpable. They are also involved in posture and locomotion. They are innervated by the tibial nerve. Posterior compartment of the leg, deep muscles. Tarsal tunnel, gateway to the foot. The tarsal tunnel is formed on the medial side of the foot, in a groove between the medial malleolus and the calcaneal tuberosity, and by the overlying flexor retinaculum. The structures that are within the tarsal tunnel from the anteromedial to the posterolateral order are as follows: tibialis posterior tendon, flexor digitorium longus tendon, posterior tibial artery, venae communicantes, tibial nerve, flexor hallucis longus tendon. The deep muscles of the posterior compartment of the leg are involved in plantar flexion and inversion of the foot, as shown. They are also involved in posture and locomotion. These muscles are innervated by the tibial nerve. Lateral compartment of the leg. These muscles are peroneus longus and peroneus brevis. Peroneus longus and peroneus brevis muscles are both innervated by the superficial peroneal nerve. They are involved in eversion of the foot, as shown. Anterior compartment of the leg. The muscles in the anterior compartment of the leg include tibialis anterior tendon, extensor hallucis longus tendon, extensor digitorium longus tendon. The anterior compartment muscles of the leg are involved in dorsiflexion, as shown. They are innervated by the deep peroneal nerve. Dorsalis Pedis artery pulse. Draw an imaginary line between the medial and lateral malleoli. From the midpoint of this line, a third of the way down, just lateral to the extensor hallucis longus tendon, the pulse of the Dorsalis Pedis artery can be palpated. Dorsum of the foot. The extensor digitorium brevis muscle is the only muscle found on the dorsum of the foot. It appears as a soft mass anterior to the lateral malleolus. Sinus Tarsi. The sinus tarsi is located between the lateral malleolus and the extensor digitorium brevis muscle. During inversion injuries of the foot, the sinus tarsi disappears and is filled by a swelling. This swelling can then be mistaken for the extensor digitorium brevis muscle.